Anterior scalene. Anterior scalene. One of the lateral muscles of the neck, belonging to the scalene group. It is deeply placed, lying behind the sternocleidomastoid. It is located behind the subclavian vein and in front of subclavian artery. It is located behind the phrenic nerve and in front of the roots of the brachial plexus. Functions: it can perform individually or in synergistic group with other two scalenes, middle and posterior. Individually, side flexor, bends the neck laterally on the same side. Synergistic. Flexors. Bilateral contraction causes anterior flexion of the neck. Rotators. Ipsilateral. Contraction produces rotation of the cervical spine to the same side. Accessory muscles of respiration. Lift the first and second ribs to increase the intrathoracic volume, aiding in breathing in case of respiratory distress. Origin: anterior tubercles of the transverse processes of cervical vertebrae, C3-C6. Insertion: scalene tubercle on the inner border of the first rib, ridge on the upper surface of the rib in front of the subclavian groove. Blood supply: ascending cervical branch of the inferior thyroid artery. Innervation: anterior branches of the cervical nerves, C5-C7. Cf. middle scalene, posterior scalene.